Hey, my name is Alex. I'm gonna do a head to toe on you today. Is that gonna be okay?
Mm-hmm.
All right, perfect. I'm just gonna go wash my hands, grab some equipment, and be back in just a moment, okay? All right, I'm over here washing my hands. I'm getting all my equipment. Come back in. Okay. We've already done some vital signs on you. All right. I'm just gonna go ahead and ask you what your name is.
Morgan,
Morgan, and what is your birthday?
January 8th, 1990.
January 8th, 1990. All right, I'm feeling your hand here. Skin is warm and the proper skin tone. Looks like you're wearing the proper clothing for the climate and for the situation. Speech is not slurred and appropriate. She's got good posture, and she's also alert and oriented. Do you know what day it is?
It is Wednesday? No,
Friday.
Friday. The what?
You know where you are?
Rasmussen College.
All right, she's alert and oriented, and hygiene is good. I'm gonna go ahead and get started here on the head. All right. I'm just looking for any sort of bumps or bruises, parasites, deformities. Her head seems symmetrical. All right. Now I'm gonna go down here to the nose. I just want you to pinch one side of your nose and breathe in. And then you're gonna do the other side. All right. I'm just gonna look in it really quick and get my pen light out. I don't see any sort of redness or any sort of swelling. All right. And with the breathing exercise, the olfactory cranial nerve is intact. Now we're going to go to your eyes. Here, I'm just going to take a look inside them real quick. Sclera is white. There's no extreme redness or no sort of puffiness or swelling. I'm just going to check your pupils. Okay, I'm going to shine this light in your eye. All right, I'm going to come right across. So just look straight forward. Pupil started at about a 3 and goes down to about a 2 or a 1 as I shine the light in. Now I'm looking at the other one while I shine here for accommodation. Alright, pupils are equal, round, reactive to light, and accommodation. Now I want you to look at my finger, and I want you to look back there at the wall. And look back at my finger, and back at the wall. Now I want you to follow with just your eyes and not your head, okay? Perfect. All right, you're just going to cover one eye. Okay. Now, just tell me whenever you can see my hand coming in your peripheral vision. You're just going to focus here on my forehead, okay?
Okay. 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 Okay.
All right, you just cover your other eye.
Okay. Okay. Okay.
All right. The optic motor, the oculomotor, and the abducen and trochlear cranial nerves are all intact. Okay, and I'm just going to check your ears. I'm going to check the cartilage. Any tenderness? Is anything hurt whenever I'm touching your ears here? Just going to pull on them a little bit. I'm going to look inside of them with the pen light. All right, there's no swelling or redness or any sort of drainage. Now, if you'll close your eyes for me. Which ear do you hear that out?
Left.
The left ear?
Right.
All right. The vestibular cochlear cranial nerve is intact. Okay, now I'm just going to have you open up your mouth for me. All right, stick out your tongue and say ah.
Ah.
And then get my pen light up. You'll do that one more time for me.
Ah.
All right, the uvula is midline and it rises with the soft palate. You open your mouth just one more time. Stick up your tongue straight up in the air for me, and then over to the side and the other side. All right, the mucous membranes are pink and moist, and the cranial nerves 9, 10, and 12 are intact. Now I'm just going to have you lift your shoulders up for me against tension. And can you turn your head to this side and to the other side? All right, the spinal accessory cranial nerves are intact. And if you'll just close your eyes for me, tell me where I'm touching on your face.
Forehead. Chin. Left cheek. Right cheek.
No, cranial nerve 5 is intact. And if you'll go ahead and puff out your cheeks. All right, raise your eyebrows. Smile for me. Okay, crayon number 7 is also intact. Alright, now I'm just going to come behind. Actually, real quick, let me see your fingers. I'm just going to test for capillary refill, and it's less than 3 seconds. I'm just going to come behind you. I'll just have you lean forward a little bit. Just checking for spinal alignment. And it's in the proper order. It's midline. Both posterior chest walls are symmetric and in line. And we're just going to start checking for some breath sounds. I want you to go ahead and take a deep breath for me. So you had symmetric rise and fall of the chest walls, and I want you to go ahead and say 99.
99. 99. 99.
All right, I had equal vibration on both sides. Now I'm going to start listening to breath sounds. Actually, before I do that, I'm going to go ahead and I'm going to hit your back just around this area. I want you to tell me if you feel any sort of tenderness, and this is around the kidney area.
Okay. No. No.
Nothing? Okay. Now I'm going to listen to breath sounds. Alright. If you please take a deep breath for me. Perfect. Excellent. Good. All right, just a couple more. If I can have you raise this arm for me. All right. If you raise this arm. Perfect. All right. I'm just looking at the anterior chest for any sort of lesions or abrasions or anything like that, or any abnormalities. And I'm not seeing anything, but I'm just going to give you a break from your breathing so we
Okay.
can actually check for the heart sounds, okay?
Okay.
So we're going to go down to the second intercostal space at the right sternal border for the aortic valve. All right, and we're going to go to the second intercostal space on the left sternal border for the pulmonic valve. We're going to go to the third sternal border, or the third intercostal space at the sternal border for the Erb's point. All right, and we're going to go down to the fourth intercostal space at the sternal border for the tricuspid valve. If you'll just lift up for me a little bit. And we're going to go to the mid-clavicular point at the fifth intercostal space for the mitral valve. All right. The rhythm, strength, and rate is all adequate. I'm still going to give you a break from breathing. I'm just actually going to go back through and do your lymph nodes.
Okay.
All right, we got the preauricular, the postauricular, the tonsillar. We've got the submandibular, submental, the posterior cervical, anterior cervical, and the supraclavicular, and the occipital. Right, now we're just going to do the lung sound in the front. Okay, on the anterior part of the body. Okay, go ahead and take a breath for me. One more. All right. just lift up a little bit for me. We're gonna go here. Okay. Now I'm just going to just kind of feel up and down your arms here. And I'm feeling for proper muscle tone, any sort of deformities, like big bumps or any sort of lesions or anything like that. All right, I'm gonna feel the toes down here for the pulse oximetry, and it's less than 3 seconds. Now I'm just gonna have you lift out your arms like this. I'm going to have you wave them forward. You're gonna wave your wrists around, wave your legs around as well. There you go. You're just gonna lift this one up in the air for me, and the other one in. All right, just got a good range of motion. You're just gonna walk that way for me. You're gonna walk back. Okay. Just got an adequate gait. You can go ahead and sit down. Now you're just gonna put your arms up for me again. And, go ahead and lift them up for me. All right. Trying to let me lift them up. There you go. And put them out this way. All right. Trying to let me pull them forward. All right. Very good. Trying to let me pull your legs forward. Trying to let me pull them back. Press on my hands like a gas pedal. Press them up. Perfect. Okay. Now press them up. That one. Hold them out. Hold them in. Okay. Now I'm just going to go ahead and check your reflexes. We've got the tricep. And this round we're going to do the bicep reflex. The brachioradialis. We're going to do the same on this side, the tricep. Bicep. And the brachioradialis. And the patellar reflex. Here. And we're going to do the Achilles tendon. And the plantar reflex. I'm actually just going to pull up on your feet a couple times. Check your pulse points actually. And we're going to start here at the carotid. I'm just going to check one side at a time. Alright, it's got a good rate and strength, times about 2. We're going to go to the brachial. Strong on both sides, about a 2. We're going to go to the radial. Strong on both sides, about a 2. We're going to go to the patellar, pedial. Goes down a rating of about 1. We're going to go to the tibial, posterior tibial. It's down to about 1. And then we're going to go to the pedal pulse. Very faint again, about 1. Okay, I'm just going to have you lay down for it. Perfect. Alright, now I'm just inspecting the abdomen for any sort of protrusions of any kind, any sort of palpations or anything like that, lesions, scars, stuff like that. And I'm not really finding anything. So right now I'm going to auscultate. I'm going to start in the right lower quadrant. With the left lower. Okay. When was your last bowel movement?
Yesterday.
Yesterday. And has your urination been regular for you? Not anything that's more frequent than normal or anything like that?
Regular.
Nothing like that, it's regular. Okay, now I'm going to go ahead and palpate. Start down here in the right lower quadrant again. I'm feeling for any masses or anything that would be irregular for the abdomen. Alright, you can go ahead and sit up. I'm going to help you. Alright, somebody's going to be in to see you in just a little bit. I'm going to go wash my hands one more time, and I'll be back, okay?
Okay.
I'm over here washing my hands.